for our health, because this is an essential step in disease prevention. Personal health responsibility means that every one of us should be actively involved in our own health through education and lifestyle changes. We now sending magazines to your house. We now bringing things to the internet, Twitter. Let the children find it out, and we are trying our best to bring that information to you. And screening and testing, I beg you, get screened and tested for all that you need, your diabetes, your this, and we're going to be sending caravans out into the communities to see how we can assist you to do that. So the Ministry of Health will continue with that, while the government will ensure that you have supportive environments to initiate a lifestyle change. This will be assisted by community care, as I said, and care in the community. We're going to move to a level where we're going to get professionals to come to your home if we can, give me your ailment, and control a bank of people, and you don't even have to come to the hospital again. But all that, first world, first PNM, that, who doing that? Right. So this will, of course, I said, we will come to you, and we will be there for you. But again, as I said, we remind you, you have to look at your diet, your exercise, and all of that. So our philosophy is just not to provide clinical and curative services, but to focus on wellness and disease prevention. When we say we care about you, this is testament to that caring. This is being our brothers and sisters keepers. As we implement our plans, you'll witness a radical change in the way you interact with the health system. Once we introduce the e-health card, your experience with the system will be entirely different. The e-health card is an access card which will allow you access. But let me tell you what it will do. It will allow you, just by swiping a card, to have access to your records, previous medical tests, and your medical history. It will also allow you to make appointments and choose your doctors, because you must have a GP where you take an annual physical. And instead of filling out all these forms and so on, your data is made available at the terminal. It means that when they give you a CDAP prescription, before you reach the drugstore, the electronic information goes to the pharmacy. So by the time you reach, it's dispensed, and you can just pick it up. When you go to the dispensary in the hospital, it will increase all of that. You can make your appointments online, offline. We will set up a hotline so that you call and you can make your appointments. It means bringing facilities to you. Any health facility that you visit will have access to your medical information through the e-health card. So if you live here in Mayaro and you work in Port of Spain, and after work, or Sandy Grande, and you decide you want to go to the hospital, as you go and they swipe your card, they know everything that they know in the Mayaro Health Center, and we could do it better. So it means the public system will be adequately staffed, state-of-the-art technology. It means our mobile emergency healthcare services will be further enhanced so as to reach first world standards. So this is just a short synopsis of that. But ladies and gentlemen, this is what we mean when we say we continue to deliver because we continue to care. The good news, my friend, is the infrastructure will continue apace. Human resources for health infrastructure will continue apace. IT development will continue apace. The transformation to bring new services to you continues apace. Healthcare for the community and in the community continues apace. And it is my belief that this will all happen much quicker than you think. We have set ourselves specific target dates to achieve our objectives to deliver over a 5-year period. The Prime Minister has given a 5-year period to have this done. And you know what I want to tell you this evening in Mayaro? We are on track. So the PNM is the only party that can deliver. We will look after you. We will care for you. And most of all, we will treat you with the dignity you deserve. In closing, I take this opportunity to thank all healthcare workers who strive to provide quality healthcare to our citizens. I have the highest respect for them and the contributions they have made to the health sector in this country. But our work is not done. There is much more to come. We need to share this vision, work together so we can provide the best possible healthcare to every single citizen. We must go above and beyond the call of duty, so that people can conclude that we are indeed our brothers and sisters keepers. And then they will conclude as well that great is the PNM, great is the PNM, great is the PNM, and it shall prevail. Let me see the girl with the steadiest. Wine till you know you got the wickedest shine. The body me you got so divine. Girl them winding up when they head is so drop cause you know you got the wickedest. Shake cause you know you got the wickedest. Wine cause you know you got the wickedest shine. Crowd and a rip from behind. Roll cause you know you got the wickedest. Let me see the girl with the steadiest. Wine till you know you got the wickedest shine. The body me you got so divine. Girl them winding up.
Ladies and gentlemen, let's hear it one more time for our dynamic Minister of Health, Senator, the Honorable Jerry Narace.
Hold that tumble down and wind up your ball. Let's go. Steady. Make it stick, make it drop one tick, top hold.
Indeed an impressive account on the health sector of Trinidad and Tobago. Ladies and gentlemen, we have stage side 2 lost children. I repeat, 2 lost children. Sherwin Wickham, and Sherwin is wearing a red and white t-shirt and a khaki pants. The other child is too distraught to give us his name. He is wearing a red and white t-shirt with denim shorts. Parents, please check with our police officers stage side. And now, ladies and gentlemen, some more cultural entertainment. I now invite you to join me in welcoming on stage Adesh Samaroo.
PNM people, somebody scream! A special good afternoon to the Honorable Prime Minister, ministers, and everyone on stage. Good afternoon. Good afternoon. Before I start anything, I want to ask you a question. Can I ask you a question? You can remember this song? Oh, daddy, Modilin. Sing, Lilin. All right, don't show off, don't show off. Don't show off. I'm going to ask this side now. This side, you can remember this one? Lotella. Lotella. All you're showing off too. All right. Everybody here, everybody, Mayaro people. If you remember this one, sing for me. A scorpion sting me, a feeling. Darling, if you... That is the easy part. That is the easy part. This is the hard one. This is the hard part. Tell me the number you're playing. All right, wait. I want to call a nice young lady on stage because I want to ask if she know the song. Come, lady, come. Make some noise to the dancer, man. Oh, gosh, come, man. Oh, gosh. Could you remember this song? Somebody scream! Chana na 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 nazir. Chana na 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 nazir. चतुरंग को गाए रस रंग को सुनाऊंगा मैं चतुरंग को गाए रस रंग को सब the top in the air now Rajindar jim jim jum everybody with flag Rajindar jim jim jum the big flag Chana na 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 nazir Chana na 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 nazir चतुरंग को गाए रस रंग को सुनाऊंगा मैं चतुरंग को गाए रस रंग को सुनाऊंगा मैं राजिंदर झीम झीम झूम Khalid, good evening. Everybody with a big flag, your small flag, If you don't have a flag, put your hands out. Put your hands out. Put it up now.